Good afternoon, friends. How are you? I am fine. So today I will go to discuss about glucose tolerance test, that is GTT or OGTT, oral glucose tolerance test. Top situation based question MCQs. With you. Are you ready with me? If you are ready, please join this live stream and enjoy the MCQ questions. Top MCQ questions. I am very much hopeful that these questions will be very much helpful to you in your coming competitive and medical lab technology examination. So let's get started. Now I will be sharing my screen in front of you and let's start to practice these questions. Okay, so let's start. Let's get started. Now I am going to share my screen with you. So before starting this MCQ, I first like to know, do you have any knowledge about what is glucose tolerance test, why this test is done, and for what for this test is done? Do you have any knowledge about glucose tolerance test? If you have any knowledge about glucose tolerance test, then please you can write something about it in the chat box. If you have any knowledge about glucose tolerance test, you can try to write something about it in the chat box. So, do you have any knowledge about what is glucose tolerance test? So, first, before starting the MCQ, we should know what is glucose tolerance test. So what is glucose tolerance test? What is glucose tolerance test? Glucose tolerance test is a type of test. It is a type of test or a medical lab procedure that measures how well how well our body processes PROCESSES, how well our body processes sugar, sugar or glucose after we have consumed a sweet drink. After we have consumed a sweet drink. So, what is the meaning of glucose tolerance test? Glucose tolerance test tells it is a laboratory procedure that measures how well our body processes sugar after we have consumed a sweet drink. Is it clear to you? If you have any problem, then you can definitely ask or tell it in the chat box. I will help you to solve your problems and doubts. So now I will move or jump into the first question. These are all situation based questions in the topic glucose tolerance test, that is GTT. And what is GTT? It is a medical procedure that measures how well our body processes sugar or glucose after we have consumed a sweet drink. Okay? Mm. Now moving to the first question. The first question is given as, here the first question is given as, a patient is scheduled for an oral glucose tolerance test, that is OGTT. He asks he asks whether he should completely avoid carbohydrate for several days before the test. Then what is the best advice? Here the question is given as, a patient is scheduled for an oral glucose tolerance test and he asks the doctor whether he should completely avoid carbohydrates for several days or not before the test. Then what will be the best advice that will be given to him by a consultant? The best advice here which should be given by the consultant is, he should follow he should follow a normal diet containing adequate carbohydrate. Is it clear to you? So what is the best advice which is to be given by a consultant? The best advice should be given to him that he should follow a normal diet which contains adequate carbohydrate. So now I will move to the next question. And the next question is given as a patient arrives for an OGTT test. That is, a patient arrives for a glucose tolerance test after eating breakfast 2 hours earlier. What should the laboratory staff do in this case? Here, a patient arrives for a glucose tolerance test after eating breakfast, which is 2 hours earlier. Means 2 hours earlier he took breakfast. Then what should the laboratory staff do? The laboratory staff should postpone or reschedule the test according to the laboratory protocol. So, what should the laboratory staff do? The laboratory staff should postpone or reschedule the test according to the laboratory protocol. Is it clear? If you have any doubt, then you can definitely ask me in the chat box. I will help you out. Now, moving to the next question. The next question is given as here a patient undergoes an OGTT test, that is glucose tolerance test. A patient undergoing an OGTT test is asked to fast overnight. Which beverage is generally appropriate during the fasting period? The beverage which is appropriate during the fasting period is water. The beverage which is appropriate during the fasting period is water. Now I will move to the next question, number 4. And the question number 4 is given as during an glucose tolerance test, a patient vomits shortly after drinking the glucose solution. What is the most appropriate action? So here the question is given as during an glucose tolerance test, a patient vomits shortly after drinking the glucose solution. So what is the most appropriate action? Here the most appropriate option is record the event. We have to record the incident. You have to record the event and follow the laboratory protocol, and we have to reschedule the test. So the most appropriate action is option number B. First we have to record the event, then we have to follow the laboratory protocol, and we have to reschedule the test. Is it clear to you? Now I will move to the next question. Here the next question is given as a patient is taking a medication that may affect blood glucose. What should the laboratory professional do before the test? So the question number 5 is given as a patient is taking medication which is affecting blood glucose. Is it clear to you? Then what should the laboratory professional do before the test? Here the answer is given as we have to document as a laboratory professional. We have to document the medication and follow the clinical or laboratory instructions. So the option C is correct. First, we have to document the medication and then we have to follow the clinical and laboratory instruction. Here is the question clear to you? Now I will move to the next question. Here the question is given as a patient is asked to remain rest during the glucose tolerance test. Here the patient is asked to remain in rest during the glucose tolerance test. Why is excessive physical activity avoided? Why should the physical excessive activity be avoided before a glucose tolerance test? Because here the option A is correct. It can alter glucose utilization and affect the test result. Because it can alter the glucose utilization of our body and affect the test result. Is it clear? If you have any doubt, then you can ask me in the chat box. I will definitely help you out. Now I will move to the next question. The next question is given as a fasting blood sample is collected before the glucose drink. What does this sample establish? Here, a fasting blood sample is collected before the glucose drink. What does this sample establish? The sample establishes baseline blood glucose concentration. What does the sample establish? The sample establishes baseline blood glucose concentration. Here the question is given as a patient drinks the glucose solution very slowly over an extended period instead of within the specified time. And what is the likely consequence? Here the question is given as a patient drinks the glucose solution very slowly over an extended period. Means the patient is taking to drink the glucose solution very late, is taking more time to drink the glucose solution, and instead because a specified time is given to the patient for drinking the glucose solution, and in this case the patient is taking more time than with, but instead of following the instruction, then what is the likely consequence? Here the answer of this question will be the test timing become invalid or less reliable, means we will get false result and nothing else. So at last what we will get? We will get a false result and the test timing will become invalid and it will become less reliable because as a result there will be no use of that test. Is it okay? Now here, the question is given as a patient is undergoing a standard adult 75 gram glucose tolerance test. The laboratory asks him to consume the glucose solution within the specified short period. What is Why is timing important? So why is timing of intaking glucose important in glucose tolerance test? It is important because glucose absorption and sampling are time dependent. Why it is important? It is because of option number A, and option number is given that glucose absorption in our body and sample timing is both time dependent. So it is very much important to follow the laboratory instruction of taking the glucose solution within a very specified short time, and for this timing of taking glucose is very much important for everybody, means for every patient. Okay, now I will move to the next question, and the next question is given as a patient start exercising vigorously after drinking the glucose solution. Why should this be avoided? Here, a patient starts to exercise vigorously after drinking the glucose solution. And why should the exercising after taking glucose solution in case of OGTT be avoided? Because exercise can influence glucose metabolism and alter the test result. So why exercise should be avoided after taking glucose solution? Because exercise can influence glucose metabolism and alter the test result or response. Is it clear to you? So if you are finding this question very much interesting, then please like and subscribe this channel so that I can bring more helpful and informative videos for you in the near future. And this question will be very much helpful to you in your upcoming competitive and medical lab technology examination. Here the question is given as a patient becomes sweaty, shaky, and uncomfortable during the glucose tolerance test. A patient becomes sweaty, shaky, and uncomfortable during OGTT, that is oral glucose tolerance test. What should the laboratory staff do first? Here, the laboratory staff should first assess the patient and inform appropriate clinical staff. Here, the laboratory staff should assess the patient and inform appropriate clinical staff. Now, the next question is given as a fasting blood glucose sample is accidentally collected after the patient drinks the glucose solution. What is the main problem? So here the question is given as a fasting blood glucose sample is accidentally collected after the patient drinking the glucose solution. Then what is the main problem? Here the main problem is, then what should be and what is the main problem here? Can you please help me to answer this question? What is the main problem? Here the main problem is the sample is no longer a true fasting baseline sample. Here the main problem is the sample is no longer a true fasting baseline sample. Is it okay? So what is the main problem? The main problem is the sample is no longer a true fasting baseline sample. Now I will move to the next question. The next question is given as a patient arrives for an oral glucose tolerance test after an unusually strenuous workout. What should be considered? Here the question is given as a patient arrives for an glucose tolerance test after an unusually strenuous workout. What should be considered? Here we can say that the recent strenuous exercise may affect glucose metabolism and we will not get accurate result of glucose tolerance test and it may lead to false result. Is it clear to you? If you like this question, then please give me a thumbs up and please like and subscribe this channel for more such live streams. Now I will move to the next question, and the next question is given as a patient asks why smoking. A patient asks why smoking is generally discouraged during an glucose tolerance test. What is the best explanation? Spo- Here, the best explanation is smoking. Smoking can affect physiological response and potentially influence the glucose measurement. So, what is the best explanation? Smoking can affect physiological response and potentially influence glucose measurements. Is it clear to you? Here, the question is given as a pregnant woman is referred for an oral glucose tolerance test because of concern about gestational diabetes. Which test is commonly used for diagnostic evaluation? Here, the answer of this question will be oral glucose tolerance test. Here, you can see that the answer of this question is given in the question itself, that is OGTT, and the full form of OGTT is oral glucose tolerance test. Is it clear to you? If you are finding this question interesting, then please like and subscribe this channel. Here the question is given as a patient is given a glucose solution during an GTT. Which substance is being administered? The substance which is administered is glucose, because OGTT means oral glucose tolerance test. Now I will move to the next question. Here the question is given as a laboratory technician collects the post glucose blood sample 30 minutes later than the specified time. Why is this important? This is important because the result may not represent the intended time point. Is it clear? So why it is important to collect the post glucose blood sample in a specified time because the result may not represent the intended time point. Now I will move to the next question. The next question is given as a patient has been fasting longer than instructed because he misunderstood the appointment instructions. What should the laboratory professional do? Here, the laboratory professional should document the fasting duration and assess whether the test should be proceeded according to the protocol. So, what should the laboratory professional do? The laboratory professional should document the fasting duration and assess whether the test should be proceeded according to the protocol. So now I will move to the next question, and the next question is given as a patient drinks a sugary beverage before during the fasting period before an GTT. What is the likely effect? Here, the likely effect is it can invalidate the fasting condition and affect interpretation. So, what is the likely effect? It can invalidate the fasting condition and affect interpretation. The next question is given as during an OGTT, the patient is instructed to stay at rest in the waiting area. Which activity should be generally be avoided? Here, the activity which should be avoided is walking and exercising unnecessarily because it can affect the test result. If we walk and exercise unnecessarily during an oral glucose tolerance test, then it may give us the false result. So, walking or exercising unnecessarily should be avoided generally before OGTT. Here, the question is given as a patient asks why the blood glucose is measured both before and after glucose administration. What is the purpose? Here the question is given as a patient asks why the blood glucose is measured both before and after glucose administration. What is the purpose? Here the main purpose of this measurement is to evaluate the body's response to a glucose load. So, what is the main purpose? The main purpose is it helps us to evaluate the body's response to a glucose load. So, a patient sample is taken before and after for glucose administration. Is it clear to you? If you are finding this question interesting, then please like and subscribe this channel for more live sessions like this. I will be taking live sessions every day. Is it clear? So please like and subscribe this channel. Here the question is given as a patient has a normal fasting glucose level but develops an abnormal glucose response after the glucose load. What does this situation demonstrate? This situation demonstrate a glucose tolerance abnormality may be present despite a normal fasting value. So what does this situation demonstrate? It demonstrates a glucose tolerance abnormality may be present despite a normal fasting value. So I will now move to the next question, and the next question is given as a patient accidentally consumes food during the interval between glucose administration and scheduled blood collection. What should be done? Here, we should document, we should first document the deviation and follow the laboratory or clinical protocol before performing the next step of OGTT, that is oral glucose tolerance test. Now I will move to the next question. Here the next question is given as a blood specimen collected during an OGTT is significantly hemolyzed. What should the laboratory do? Here, the laboratory professionals should assess the specimen first to assess the specimen acceptability, and according to laboratory policy and follow the laboratory policy, and if recollection is needed of blood, then also the laboratory professional should do. If recollection is necessary, first the laboratory professional have to assess the specimen acceptability and follow the laboratory policy, and also need to recollect the specimen of blood if necessary. Is it okay? So if you have any problem, then please write me in the chat box. I will definitely help to answer you in this case. So now I will move to the next question. The next question is given as a patient is scheduled for a oral glucose tolerance test but has an acute illness on the day of testing. Why may the test need to be postponed? Because acute illness can affect glucose metabolism and test interpretation. So, as acute illness can affect the glucose metabolism and test interpretation, so a patient who is scheduled for OGTT and have acute illness on the day of testing must be postponed. Is it clear to you? If you have any doubt, then you may ask me in the chat box. I will definitely help you out to solve your problem. Is it okay? Now I will move to the next question, and the next question is given as a pregnant patient undergoes glucose testing as part of screening for gestational diabetes. What condition is the test intended to help identify? Here, the condition which is intended to identify is abnormal glucose regulation during pregnancy. Okay, now I will move to the next question. And the last question for this session will be a patient asks why the glucose solution should be prepared accurately. What is the main reason? Because the administered glucose load must be standardized. So why the glucose solution should be prepared accurately? Because the administered glucose load must be standardized. Is it clear to you? So thank you for giving me a patient hearing. If you are finding this question very much interesting, then please like and subscribe this video. Now I am signing off from this live stream. So thank you, friends, for giving me a patient hearing. Thank you. Okay. So thank you, friends.